Good Wednesday morning. October is Breast Cancer Awareness Month, and joining us today to talk more about that is the Medical Director at Jupiter Medical Center, Dr. Lynda Frye. Thank you for joining us.
Yeah, we want to talk about the controversy surrounding mandatory reporting of breast density and mammograms. Specifically, let's start by asking you, what are dense breasts?
So dense breasts are actually a variation of normal. You can have anything from a fatty replaced breast to a very dense breast that has very little fat. And why that's important is because on mammography, a breast cancer is going to be white and a dense breast is white. So you're looking for kind of like the polar bear in the snowstorm.
All right, so people who have been diagnosed with dense breasts, what should they be doing?
So with mammography, you can miss as much as 20% of breast cancers in a dense breast. So if you add another imaging study like ultrasound or MRI, if you have a strong family history, you're going to pick up a lot more breast cancers. And our sensitivity with 3D mammography and ultrasound, which we have at the Margaret W. Needland Breast Center, is going to get us to sensitivity in the mid-90s.
Is that something that can a fit person have dense breast?
Absolutely. In fact, you're not going to know if you have dense breast just by how somebody feels. You're only going to know that by what we see on the mammogram. And so somebody with a lower body fat content is probably going to have more dense breasts than somebody who has more fat. A lot of it is hereditary, though. If your mom had dense breast tissue, you'll probably have dense breast tissue.
I was just talking about mammography in general. It seems like we have a lot of different reports out on how often you should have that done. What are the symptoms you should be looking out for, and how often should you have that test done?
So if you are of normal risk, having a mammogram started at 40 and then going every year, there's so much data to support that, and anything outside of that recommendation is not going to be in your best interest. So absolutely every year starting at 40 for average risk. Things to look out for: if you feel a lump, absolutely come in and let's take a look at you.
No matter the age? No
matter the age. Even if you're less than 40, we can always start with ultrasound and take a look, but anything that seems different for you, nipple discharge, focal pain, or absolutely a lump.
And specifically, if you have a history of breast cancer, you want to make sure you get it done earlier than 40.
Family history is so important. Asking your doctor and being your best advocate and being proactive is absolutely what we need to do for ourselves.
All right, Dr. Frye, thank you so much. An important conversation, a good reminder for everyone. We appreciate your time.
Thank you.
All right, let's get over to Sam Kerrigan. We're talking about